The past year has been tough on everyone, especially teenagers who were forced to stay home and away from their friends for the most part because of the pandemic. A new CDC study now finding that suspected teen suicide attempts increased significantly this spring compared to the same time in 2020. Bridget Chavez has more.
Dr. Johnson from OHSU says it's important for parents not to just rely on their teens to come to them, but they should be checking in on them, asking them questions about self-harm, especially if their teens are showing signs of anxiety or depression. Teens and their families have been under a heavy amount of stress this past year because of the pandemic, and that's reflected in new numbers from the CDC showing attempted teen suicides are on the rise.
That is my impression and clinical judgment. I mean, so much of our coping strategies went out the window, especially for teenagers. Teenagers cope by getting outside the family and being with friends and peers and doing activities and being more independent. And this led to more dependence.
Dr. Kyle Johnson, a child psychiatrist at OHSU, tells me the hospital saw 38 patients in May of 2021 seeking care for suicidal ideation or self-harm compared to 23 the year before. While this increase is concerning, Johnson says parents can take a proactive approach by talking to their teens about suicide.
We know from research that bringing up suicide does not put thoughts in people's heads, does not lead to more adults or youth attempting suicide.
Johnson says it's important to ask teens questions, especially if they show signs of depression or anxiety. Here's an example of how to bring it up with your teen.
We are all under considerable stress right now. I know that this pandemic has had a huge impact on you and your friends. You're not able to see your friends, not able to attend school in person. And that can lead any of us to get down. And I wonder if you've been feeling down or depressed or sad.
Johnson says to follow up with more questions.
Well, sometimes when we're down or really depressed or not feeling good about the situation, we may have thoughts of wanting to die or end our lives. Are you having those thoughts?
Depending on their response, Johnson says you may need to reach out to a primary care doctor, or if your child expresses intent, bring them to the emergency room.
That's why we want to be checking in with them. We shouldn't just rely on them reaching out to us. We need to be, as adults, need to be checking in with them.
Johnson also says it's crucial for parents to make sure teens can't get to things like guns or medication.
Because so many suicide attempts in our youth are impulsive, often just minutes between making the decision to kill oneself and actually engaging in behavior that could lead to someone dying.
It is important to note, per the Oregon Health Authority, that the state has not seen an increase in youth dying by suicide, and while that is positive, it does not lessen the mental health challenges that teens are facing.